You are welcome to my channel. Thanks for visiting. You can see on your screen, this is Colchicine. Some people are familiar with this medication, might be because of gout. But you know today that this good medication could be dangerous. It has narrow therapeutic index. What is that all about? Don't worry, I will get into details in a bit. And it's not meant for gout alone. Can you take a guess? Yeah, could be useful to even deal with heart-related conditions. Have you heard about pericarditis in the past? Oh, don't let me tell you everything yet. Without further ado, let's go and find out colchicine. How good, effective is this medication and how dangerous could it be? Let's go through the first note here. Number one, colchicine has a narrow therapeutic index. How do I mean by this? Don't worry, I will explain in a bit. Also, take note that colchicine is not an analgesic agent. No, it's not a painkiller. Why that? You will know in a bit. Please, you can use this agent with other agents when you have pain. For example, in the treatment of acute gout flares, the emphasis will be on low dosage. Why that? Narrow therapeutic index. And accumulation is more likely going to occur, giving us serious headache with the narrow therapeutic index in anyone of pediatric age group or elderly people. Accumulation is also going to occur in renal failure or hepatic impairment. Also, in the phase of hepatic enzyme inhibitors, don't worry, I'll give you the list in a bit. And also, accumulation is likely going to occur in the face of narrow therapeutic index and fatal outcome when there's accidental overdose or deliberate overdose. Some brands, like these two, are meant for prophylaxis of gout flares. They are not meant for the treatment of gout arthritis. Yes, I have promised that I will address narrow therapeutic index of colchicine. There is an amount of drug that is effective, and I will tag that as A. There's an amount of that same drug that will cause life-threatening or dangerous effects. I will tag that as B. The difference between A, that is the concentration that is effective to deal with the condition we want, and B, the concentration that will give us trouble or kill the patient, the difference between the two is therapeutic index. For example, if the concentration that is effective is 5 milligrams, and B, the concentration of that same medication that will give life-threatening condition or dangerous effect is 100 milligrams, the therapeutic index in this case will be 20, and that will be a wide therapeutic index, meaning from 5 milligrams, you must have made serious mistake about 20 times before it will give you serious trouble. Another example will be example 2, where 3 milligrams is enough to deal with the condition we want the medication to handle. But 6 milligrams of the same medication will tilt the patient to a life-threatening status or even death. The therapeutic index in this case will be 2, and that means the therapeutic index is narrow, too close. It is too close to be treated from the concentration that is going to solve the medical problem 2, the concentration that is going to kill the patient if we overdose. Example of 1 here is what we know as wide or large therapeutic index, which is safe. While example 2 here, which is just 2, is narrow therapeutic index, meaning a little increase. You just double dose, then you might end up in the morgue or mortuary. Narrow therapeutic index. Let me explain further. Any drug with narrow therapeutic index must be dosed carefully, must be administered with precision, and must be taken by the recipient as recommended only. The patient or recipient must be followed closely or carefully. Signs of toxicity or side effects must be reported and addressed promptly. The example here is colchicine. I will give more example if you come to my channel to check my presentation on narrow therapeutic index. Colchicine could come under different brand names, and you can pause and check through. It belongs to the class of medications known as anti-gout, either for prevention or treatment. It's not a painkiller. Forms could be in form of tablet, either generic or the brand name in your jurisdiction at 0.6 milligram per tablet, or extended release tablet that will cover 24 hours per oral under this brand name at 0.5 milligram. Could come in form of capsule for per oral, either generic or the brand name available at 0.6 milligram, or solution for per oral use under this brand name at 0.6 milligram per 5 ml. Administration. This medication could be administered with or without food, but must be administered with loss of fluid. Adequate fluid intake, please. Dosing and administration. Be sure you follow the order given by your physician, please. Meaning, if this is prescribed for prevention of gout, use it as such. If it is prescribed for the treatment, use it as such, because of narrow therapeutic index that could be catastrophic. For the treatment of gout, it's likely your physician will tell you take 1.2 milligram at the first sign of the gout. Then, the following 2 hours, you can repeat using half of that, which is 0.6 milligram if so needed. If it is prescribed for the prevention of gout, you will be given a lower dose of 0.6 milligram once daily, and the maximum you can take will be 1.2 milligram per day. Other conditions and doses that will be discussed with your physician or pharmacist or clinical pharmacologist. In all, don't overdose, please. Now, mechanism of action. Colchicine could be described as a great inhibitor. It inhibits beta-tubulin polymerization into microtubules, disrupting it, so no formation. It will also inhibit activation of neutrophils, and also inhibit activation of interleukin-1 beta. Uses of colchicine. Gout. If it is prescribed for prevention, you are likely going to be given as 0.6 milligram once daily, that is for prophylaxis, and you can use that with allopurinol. If it is meant for gout flares onset treatment, it's likely you'll be given 1.2 milligram of colchicine start. Then, 0.6 milligram in 2 hours after, if so needed. In pseudogout, we have calcium pyrophosphate, crystal arthritis. Colchicine is also helpful. Still now dealing with uses of colchicine in emergency room, in acute coronary syndrome prevention of ischemic heart disease. We can use colchicine with other agents. In pericarditis, either acute or recurrent pericarditis, colchicine is welcome. In post-pericardotomy syndrome, you can make use of colchicine. In atherosclerotic cardiovascular events, colchicine is helpful. Still on uses, in Becker syndrome or Swiss syndrome, that is acute febrile neutrophilic dermatosis. Remember, it has the capability to inhibit activation of neutrophils. In familial Mediterranean fever, and also in all these conditions, please contact your pharmacist for further details. Now, contraindications. In the face of hypersensitivity reaction in the past to colchicine or any component of its formulation, then no colchicine today. This man or woman or child is battling with severe renal or hepatic failure or both, then no colchicine today. Why that? There might be accumulation of colchicine, and remember, it has narrow therapeutic index, meaning the recipient could be tilted into catastrophic reaction that could be fatal. The presence of permeability glycoprotein inhibitors like clarithromycin, ketoconazole, non-dihydropyridine calcium channel blockers, that is verapamil, dithiazem, and the list goes on, means we cannot use colchicine. In other words, we cannot use colchicine with permeability glycoprotein inhibitors. No, we will not. Monitoring. We'll revisit the history again and then find out if we are winning now after taking colchicine. We'll check, that is physical examination. We'll head to lab. What is the value of uric acid right now? How about complete blood count, because we can be dealing with bone marrow depression and pancytopenia. Renal function test. Remember, severe renal failure means accumulation of colchicine and fatal outcome. Liver function test, because hepatic failure can lead to accumulation and fatal outcome. Adverse reactions. Gastrointestinal tract. There may be nausea, vomiting, and diarrhea. Reproductive system, a man might suffer azoospermia or oligospermia. Still on adverse reactions, under hematology, we could be faced with aplastic anemia, disseminated intravascular coagulopathy, bone marrow depression, or pancytopenia. We might be faced with myopathy or myalgia. There may be pharyngeal pain along the respiratory system. And of course, needless to say that the liver might give us trouble as hepatotoxicity. The central nervous system is not spared because we might have neuropathy or peripheral neuritis. And back to the renal system, we may run straight into rhabdomyolysis in the face of renal failure. 1. Organs like kidney, liver, and heart must be working well before placing that man or woman on colchicine for a long time. Pregnancy and breastfeeding could be controversial. There is no indication that says you cannot give it, but if you have alternatives, please go for it and keep colchicine off the table. But if there is no alternative or alternatives, weigh the disease condition and effect on breastfeeding and pregnancy, and discuss in details with the recipient. Also, let the patient know every other alternatives you could use that you cannot lay your hands on. And then seek the assistance of pharmacists or clinical pharmacologists in your domain, and plan to increase monitoring. Once all these could be in place, then you may take the risk and administer. Not everyone can receive the same dose. Please. Still on warning, there may be gasping syndrome, and that will occur in neonates, particularly if you are administering colchicine in neonates with formulation that contains benzyl alcohol. I'll have a separate presentation on this phenomenon later on. Overdose will have catastrophic effects. It could be fatal. In this case, it might be accidental, and sometimes it may be not. But just take note now and forever that either intentionally or not, if you take high dose of colchicine, then you are going to end it all. Remember, it has narrow therapeutic index. Drug-drug interaction. Permeability glycoprotein inhibitors will increase serum level. And I've given you examples like erythromycin, ketoconazole the other time, including non-dihydropyridine calcium channel blockers, that is verapamil and diazepam. Grapefruit will inhibit enzymes, hepatic enzymes, and increase colchicine serum level. Be careful. It has now therapeutic index. The patient is taking grapefruit, is on 0.6 milligram colchicine. But if care is not taken, you might double or triple the dose, or quadruple, and then they are calling you that we don't know what's happening to grandma or grandpa. Please let us add vitamin B12 to the treatment of anyone on this medication for a long time. Why that? It can decrease the absorption of B12. So, the individual on colchicine becomes confused, anemic, blah, blah, blah. Check the B12 level. When you check the B12 level, if this patient had been on this medication for a long time, particularly those taking it for prevention, then what is happening is that colchicine is blocking the absorption of B12. So you need to exogenously give B12. And with that, I've arrived at conclusion. Remember the therapeutic index and the danger associated. I cannot say this enough. Please. Why that? You are trying to help that man or woman to get out of the gout arthritis, or familiar Mediterranean fever, or any other condition or conditions you are using it for. But you might also kill him or her. And patient 2, be careful, you might kill yourself. Not to be used as a painkiller, please. Rather, discuss with your physician. He or she will give you painkiller. Like if you have acute flares of gout arthritis and you are given colchicine, that is not going to be the only medication you'll be given. Non-steroidal anti-inflammatory drugs might be added. Example, indomethacin can be added. So, with that, I come to the end of this presentation as per Colchicine. Someone will say, why are you so concerned? Why are you sounding so loud? Oh yeah, Colchicine can kill, but it's also helpful. Thanks for listening. Please remember to share this with all your friends. No, anywhere you can send it to. You have my permission. I appreciate it.